The Affordable Care Act was launched a year ago, and it had a difficult start. Thanks for watching. I'm Josh Rowe.
And I'm Latricia Thomas. As 2015 open enrollment begins, some local residents say they're still facing some hardships. News Channel 9's Micaiah Thurman joins us now with their stories. Micaiah.
Josh, Latricia, good evening. I was surprised to learn that millions have signed up and even more are still interested in coverage. But today, some Tennessee residents say they're frustrated with the process and tired of getting the electronic runaround. Uninsured and uncertain of his family's future, Bobby McKeehan sits inside of his Lafayette home, overwhelmed with his wife's latest medical bill.
My family's health and well-being, is important to me. If I made enough money, yeah, I would have insurance.
McKeehan's wife was in extreme pain on Friday night. Because he doesn't have a car, she was rushed to the hospital in an ambulance.
Okay, just for this weekend, just the ambulance bill was $1,600 and I think $70-something just for a 45-minute ride to the hospital. I mean, that's ridiculous. I can't pay that. I have no insurance. I don't make enough money to get Obamacare. I make $200 a month too much to get Medicaid or Medicare. So we're completely without insurance.
It's a tough situation that one healthcare expert describes as all too familiar.
That is something I've heard of before, and certainly not good news. A lot of people are falling into his similar situation.
Catherine Jeter works as an outreach and enrollment specialist for Erlanger Health System. It's her job to help people like Bobby McKeehan sign up for the coverage that he needs.
So a lot of individuals like this gentleman are falling into what we reference as another donut hole or coverage gap, and that's the TennCare gap. They need to come in and reevaluate.
We shared McKeehan's story with the expert because without a car, coming in becomes even more difficult. Today, she says that people in that situation do have options.
If you are taking more costly prescriptions, there are resources that can help you either prevent going into the donut hole, or certainly once you fall into the donut hole, kind of get you out of it quicker.
There are enrollment events currently scheduled in Southeast Tennessee to answer any questions that residents may have about their insurance. For a full list of locations and times, log on to NewsChannel9.com. Josh.
Micaiah, thanks. A new University of Tennessee report says the number of uninsured people in Tennessee has hit a 10-year low. The number of people without health insurance decreased by about 25% in the first year of the health insurance marketplace. It was implemented under the Affordable Care Act. There are still an estimated 470,000 people without insurance in the state, or about 7.2% of the population. Dr. Leanne Luana co-authored the report. She says the decline was significant, but not necessarily unexpected after the rough start for the Affordable Care Act.